All right. Hi, everyone. Welcome to the first ever webinar from Coronis Health. We're very excited to be here today with Cam Cox, and he is going to be speaking on pivoting during a pandemic. So a lot of you are joining right now while you're getting situated. I will give a little introduction for who Cameron is. So Cameron is really the MacGyver of healthcare business management, and he's definitely a man with a mission. He really wants to help medical practices thrive. Once a practice administrator himself, he's now the president and CEO of his division in Coronis Health, which is a leading medical billing and consulting firm. Cam and his team have worked with more than 500 medical practices, ranging in size from a one part-time physician to over 50 providers in virtually every medical specialty. He's a fellow of the American College of Medical Practice Executives, which is the most prestigious designation you can earn in the medical practice management profession. He has undergraduate and graduate degrees in healthcare administration from University of North Carolina at Chapel Hill. And never settling for the status quo, Cam is passionately engaged as an advocacy leader for the North Carolina Medical Group Managers Association. He's an active member of MGMA at a national level, and he regularly speaks at national and regional organizations on a broad range of topics, including practice management, revenue generation, telemedicine, and a wealth of other topics that are all challenging today's medical practitioners. So I'm very excited to see what he has in store with us today, and I'm looking forward to hopefully having him share a lot of education with the rest of you. So before we get going here, you can use the features inside of Zoom if you're tuning in live, the Q&A feature or the chat. We encourage you to ask questions as we're going. We don't need to wait till the end. We're happy to stop and engage with you throughout the way. We want to make this as interactive and engaging as possible. And I still see some people coming on, so I'd like to launch a little poll to get a little bit of insight about who is here, if that sounds okay. So let's see. There should be a poll up on your screen right now. So can you guys answer some of these questions, please? Tell us who you are. Are you an independently owned physician practice, or are you part of an ASC? How much did your practice decline due to COVID? Is Coronis your current medical billing solution? I don't see a lot of you taking this poll. What is your job title? How did you hear about this webinar? All right, now they're starting to come in. Thank you, guys. And you're welcome to already start populating any questions in the Q&A if there's a specific topic you were looking for to get answered. In the meantime, let me let a few more of you vote here. All right, last chance. All right, so only a couple of you voted, but that's okay. So most people here are part of a private practice. Most people had less than a 20% decline due to COVID. Coronis Health is not the current medical billing solution, so you guys might not be that familiar with Coronis. You heard about this via email, and a couple of you are practice owners, office managers, or other. Wonder what that is. So anyways, thank you so much for answering our polls. Again, if you're just tuning in, feel free to use the chat feature or the Q&A feature so we can try and get your questions answered throughout this webinar. And without further ado, I'm very excited to introduce Cam. Thank you, Cam.
Thank you. Appreciate it. Welcome. Thank you for those of you who are on the East Coast. I appreciate you taking a little bit of time out of your evening to spend with us. For those of you on the West Coast, it's still work time, I guess, technically speaking. So I do appreciate it. This topic, pivoting during the pandemic, I'm sure a number of you have probably participated on other webinars. A lot of the information I'm trying to share this evening is very recent, things I've read recently, and as far as some of the research goes. we've got this structured such that we have it in a kind of a question format. So as we go along with this, you'll basically see slides from us on questions we thought were pertinent that people have asked us, that I've spoken about in other town hall sessions, other webinars. But it is very fluid. None of us expected a pandemic to occur. None of us expected to have the shutdowns that we had. None of us expected the impact that we saw. So this is all very adaptable. We are having to be flexible. So throughout this presentation, I want you to treat it the same way. Feel free to ask us any questions. And if I don't have an answer, you'll see at the end an email address for me. I will find an answer if I can and help to get that back to you as quickly as I could. So, all right, so we're gonna just kind of get this show on the road. First question, what is the most important learning we need to take away from 2020? To give you a little preface to actually how I present and how I think, I'm a little awkward. I don't think a lot about healthcare. The very first thing I think about with regards to the most important learning we need to take away from 2020, we figured out actually how powerful the government is and actually how influential our consumers are. And I choose the word consumers on purpose here. First, we'll just talk about the government and actually the true power of the government. Before COVID, HIPAA was the most terrifying word for anyone in healthcare. With the breakdown of the use of various forms of technology to allow us to see our patients quickly, easily. I think about my mom, who I think she might be on an iPhone 6, if that still exists. It has a crank on the front of it, so I'm pretty sure it's old. But my mom was using a video call with her doctor at the hospital. My mother won't even text me back, but she was using her iPhone 6 to communicate with her provider via, I think it was FaceTime or something like that. So the government broke those barriers down very, very, very quickly. They also reinforced the mechanism of reimbursement through CMS. This was powerful. This actually just showed us the real control that they have in our daily lives with regards to the practice of medicine. The second biggest piece was actually the influence of the consumer. And one of the things that I recently read about, and I'm using this, and I've talked about this before in other webinars, and I will tell you, some of you may be quickly offended by it, and it's not intended to be, but I think a lot about the service industry with regards to restaurants. And that's just, and the reason I think about that is because a lot of the obstacles we have in the delivery of care and the delivery of a service like a restaurant industry, we have a lot of the same issues. We have waiting rooms. You have to wait for stuff. You have servers. We have front desk people. We have nurses taking folks back. We have a lot of similar issues. And the way that actually is delivered is interesting. So recently I've read about various articles about where Starbucks is actually modifying how they intend on delivering their product to their consumers. And I think about in healthcare, we're going to actually have multiple ways in which our consumers expect to receive their product or their service. And that's how my brain works with regards to healthcare. Also, I've done presentations for a number of years, and I'll tell you that one of the things that really hit me was a lot of times in healthcare, we tend to sit back and wait for everyone to come to us because, quote, people need healthcare. Even if you talk about with folks in the financial industry, a lot of people have always invested in healthcare because everyone's always going to need healthcare. That is a true statement. What we did not anticipate was how they were willing to receive it. The need is there, but the delivery mechanism is really what the big influencer was on this. And so I think a lot of what we're going to see going forward in 2021 and 2022, I think a lot of that's going to come from the consumer's expectation of us and what we are willing to accept going forward. Another question that I thought was pretty important in all this, so what are some of the things that you noticed practices were struggling with the most last year? Well, first of all, it was just the absolute shock of the demise of business. I mean, it was just an absolute shock. To give you a little perspective, here's a recent slide, and I try to source all these so that you guys can go and find them. This was just literally an article I read today about various specialty lines and their impact of loss. Now, what's fascinating about this is our first inclination is to think in terms of direct correlation. So we read this and we go, oh, okay, well, these all got hit heavily by COVID. It makes perfect sense. Pulmonology, that's a lot of older populations, people with COPD. They couldn't go see their provider, et cetera. Well, what's interesting is pediatrics, number one. What was fascinating about this is the decline in business is because those kids did not go to school. They were not allowed to be the walking, talking petri dishes. For those of us who have children understand, they didn't allow that to happen. I recently took my son this past week to his pediatrician's visit, his annual visit, and in talking with the doctor, he said it was just fascinating. It was such a really slow fall because no kids showed up with flu. No one had the flu, and it makes perfect sense. So these indirect effects of COVID have also impacted practices that we actually have to think about as we go forward. Another great example, number 5 there, dermatology. Before COVID, I had met with one of my clients and we had actually determined, we used a for-profit entity that does nothing but telemedicine. You guys may have heard of this company called Teladoc. Well, on their website, they advertise various dermatology needs that they can do via telemedicine. We applied that to various diagnosis codes from the prior year for this practice and identified that 17% of everything that the practice billed for in 2019 could, quote, be done via teledermatology that Teladoc was advertising for, which makes for a very difficult competitive environment as you're going forward. But as you can see, a lot of this, this impact had both direct and indirect. Surgery is a great example. Several of our orthopedic clients had immediate impact because ASCs and surgery suites were closed. They began to reopen. We had a second surge. A lot of my clients also, they got impacted on that as well. Continue to have a little bit of a problem. It depends on where you are, what part of the country. There are some differences, and we're seeing that, some regional differences in access. But again, a loss of business was the most impactful thing I think everyone felt and saw. So this is one of the questions that you see this slide. So I put this slide up there on purpose because it really takes it takes major things for us in healthcare to make a decision that we're going to do something. So if you think in terms of electronic medical records, it took the introduction of $21.3 billion. We had to give doctors money for them to actually go and get EMRs. It took a pandemic for us to actually seriously take telemedicine as a form of delivery. Even though the Jetsons were doing this, when I was a kid in a cartoon, you see this and you go, wow, we've known about this for a long, long time. We were unwilling to adapt to it. With this, the most vital piece of technology that practices have to adopt in 2021 and why? This slide gives us a great representation of not just telemedicine being the avenue that we actually need to address. If you've heard me speak before, I talk a lot about patient interaction and patient communication, how people want to be communicated with. Earlier today, when Risa and I were preparing for this, Risa wanted me to chat with her or text her, and I refused to. I emailed her because I'm a Gen Xer. That's what we do. That's how we communicate. We do not communicate via text unless our children are communicating with us. So when you start thinking about this, when you think about this, patients actually have the same expectation. I now expect a text from my dentist. It's actually how it actually happens in my brain now. I have completely been twisted around, and I do not intend on going back to my dentist calling me. I do not expect them to call me. I expect a text. I have been trained that way. We have had a year of training in a lot of this. We are retraining our patients. We are retraining our consumers to have these expectations, and I don't think many of them are going to go back. Patients want to be communicated this way, and it facilitates all the way. One of the things I find most fascinating about this is the quick adaptation to our waiting rooms. That was one of the most fascinating things. And when I first started doing presentations, one of my clients did a brilliant thing and had their patients download an app, and I think it was called wait.com or something like that. It was a wait app that was used primarily in the restaurant industry, And they used that to actually allow patients to stay in their car and notify them when they were ready for them to come in. Now, think about this too. One of the jokes I've always sort of joked about in healthcare is we are the last group really to have receptionists. I can't really think of anybody else who has receptionists except lawyers who pay, $500 an hour for, I guess you can have a receptionist there, but we're one of the last ones. And this whole pandemic broke that down. We realized very quickly, we don't necessarily need a receptionist. A lot of the stuff can be done via a kiosk, can be done via a cell phone, can be done electronically. That's the drive here. And I will say also, as you look down this continuum, you see some other pieces in there: remote device integration, AI-driven triage. These are next evolution of technology. There's no doubt about that, particularly as we use more and more of this technology. I can tell you about a host of companies that I sort of like to keep my eye on with regards to like the remote device integration, the AI-driven triage. Those pieces, those intrigue me. Just because of all the information that we now have at our disposal. And you think about the remote device integration too, you start thinking about patients who are in rural parts of the country who have a difficult time getting in. They need to stay remote for a little while until COVID is completely brought underneath control. This remote monitoring devices, these are essential to us in healthcare. So it's not just telemedicine that we actually need to focus on. It's the whole continuum of technology that we really need to race forward. One of the other things I think a lot about is for a very, very long time, we were in sync. We actually sort of walked in sync with the banking industry, who now has sort of propelled past us. In healthcare, we were always just about as archaic as banks were in a lot of things and a lot of the ways in which we did things. Banks have surpassed us. So we really we're kind of one of the last industries that really needs to catch up in communicating with our consumers the way they want to be communicated with. So why should MDs embrace this technology and not shy away from it? Well, first of all, I'll put this slide up, and I'm also going to twist your mind a little bit because I want all of you who are out there to think about this. I mentioned earlier about restaurants. How many of you actually, when you get home on Friday, you start thinking in your brain, okay, how do I want to eat this evening? And you decide, I want takeout. So now you have to decide, because we didn't used to have this option, do I want to DoorDash it? Most of our restaurants did not, particularly our local restaurants that we loved and we were missing. And so DoorDash became a prominent player in our space. Or I can do it online and then go pick it up. Or I can actually go and possibly order there, do the drive-through. I have these multiple ways of doing things. Now, also for those of you who have had this experience, because I have personally experienced this, I know Risa had her child experience this. I had a drive-through COVID test. When I first had my test, I was having a colonoscopy, and so I had to have a test done, the COVID test, before I was allowed to have the colonoscopy. I did not understand. In fact, my first thought in my brain was, when I got my appointment, that I was going to drive over to UNC, to the Ambulatory Center, and I was going to go inside. That was my thought. And my appointment time was 9:30. I was shocked and stunned as I got there, and there was about 12 different folks who were directing traffic, and I never got out of my car. I did my paperwork. I handed it to another person. I drove up. Someone stuck something up my nose, and I drove off. And it was very much like Chick-fil-A. It was odd, except it was not as good as Chick-fil-A because I didn't get a sandwich at the end. I got something stuck in my nose, which was a little bit less pleasant. But my point is, if you think about just the efficiency that we introduced very rapidly, we had to, in delivering those tests, I think the patients are going to remember that. Some will. Now, some will actually not, want to stay engaged that way. But if you look at this list, you start thinking about that logically, a lot of this makes sense. It truly, truly makes sense for us to actually begin exploring delivering care this way in an efficient way. This is what some of the shared savings programs attempted to do and are attempting to do now. The use of telemedicine can really help us break down some barriers to patients who may not be able to get care. We now have been forced to do this. The escalation, I'll tell you, I actually have some of my own notes here. So just to give you guys a little bit of perspective, one of the competitors, Teladoc, that's the competitor to all of us who are trying to deliver telemedicine, they did post losses, but some of the things that were more fascinating to me was that they actually were up 156% year over year. 156%. They had 10.6 million visits in 2020. Teladoc did. Now think about that just for a moment. This is actually very, very impactful for us. One of the things that our plan that the President Biden's administration is planning on doing, and it really is logical and makes sense, is actually delivering care through Walgreens and CVS and some of these other players. And it's basically because they have the distribution mechanism in place to do this. And the comfort level, for those of us who have been in healthcare like me forever, the comfort level that we now have to go to our pharmacy to receive care. Remember how we all sort of laughed and made fun of retail clinics? Remember that? We all did it. We all laughed and said, there's no way my patients are ever going to go to Walgreens to get any type of visit. And my patients aren't going to go to Walmart. No, they're not. Nobody's ever going to take my patients because they loved me. We all said that. Now this is one of the primary distribution mechanisms for one of the worst pandemics we've ever experienced on our planet. So I want you to think about that this is real. And I mentioned this from a strategic competitive position is why I talk about this. I recently was hospitalized. One person was allowed in the hospital with me during my stay. This allowing for family connections to hospitalized patients, this was a big deal. This was a big deal to me. Like, so actually facilitating that was a very important component to my time when in hospital. When you actually look at some of those other, the emergency room forward triage, these are fantastic things that we really should not let go of because they are good for us as a community, as a whole. Now, when you look at it from a business standpoint, you might look at it with a different view lens. But when you look at it from a healthcare perspective, these are good moves for us. So what are some steps practices should take to implement this technology? I simply think you ought to understand who your patient population is. And I know that seems very simple and generic, and I don't mean for it to. I'll go a little deeper on this one too. This discussion is, we can do some very simple things with the data that we have. There's a great article that I did not include in this presentation. If you're interested, you can, again, you have an email address at the end of this presentation, my email address, you can email me and I'll send you several links of different articles I read. One of the articles I read was sort of fascinating because it broke down that there are 4 categories of people that will re-engage and how likely they are to re-engage in a telemedicine way. And it's very interesting because when you look at it, they actually break it down by kind of financial classification, like how much money a lot of these people make on their annual income, their age as well, and typically also their education level, like what, if they got a graduate degree, if they got a college degree, high school degree, et cetera. So understanding that patient population, you have a lot of that data, particularly generational data. So go back to your practice. For those of you who run a practice or are part of a practice, go back and actually do something very simple. Break your patients down into generations. Break them down into millennials, Gen Xers, boomers, and then it will give you a little bit more perception about who is likely to have higher levels of fear and who also is very likely to be very comfortable with telemedicine being their solution going forward for that which they can do. In fact, they'll want it. That's what you'll find. They'll want it. My daughter, who is during this pandemic, has actually really had exasperated migraines, has met mostly with her neurologist via telemedicine. And it has been great because it's great for her. It also allows us to be engaged as well. And this patient population, that's a great population who really wants it this way. It's sort of fascinating. I have another daughter who is in Florida who has been trying to get her physician to respond via the portal and has communicated 3 times, and she doesn't understand why she must call the practice. And in fact, she's horrified by the idea that she has to call the practice. And she keeps telling me, she said, well, I emailed them in the portal. I don't know what else to do. So understanding your patient population is key and essential. Putting their needs first is also essential. One of the things, again, I'm going to reiterate back to the beginning, the power of the consumer in this pandemic, we recognize very quickly we need them from a business standpoint. We have to have them. So we need to twist that. I've always really been a big proponent of this. We always need to be putting them first. How do they want this? How do they want their care? What can I do? That's our job. I am right now watching, for some of you may, I don't know if any of you have been watching Netflix and stuff like this during the pandemic. Has anybody been doing that?
Yes.
I'm watching right now Stranger Things, and I'm a kid of the 80s, and I'm fascinated. And I sit on a soapbox and talk about the complete destruction of small business in America by the likes of Amazon and Walmart, et cetera, yada, yada, yada. I had forgotten until I started watching the show that malls first destroyed downtown businesses. I'd forgotten about that because I was a kid of the 80s, and what was most fascinating me about malls was that's where I could actually see girls, which was great, but I also could go to the arcade. And so understanding that putting those patient needs first, that's what we have to do. We need to be adaptive to this as we go through it. If you find it to be difficult and hard, just simply research the market. You know, this is the fun thing that we get to do at dinner time now. Like when my kids ask me questions and I don't know the answers, they'll literally Google it. And I've been asked before by my kids, like, Dad, what did y'all used to do before Google? Like when you didn't know stuff? I said, I didn't care. You know, I just simply didn't care enough. But you can go out there, look things up, explore technology, look at options that exist in the marketplace. Ask colleagues, jump on listservs, join your medical society, ask peers. Do this to at least, yeah, go ahead.
Oh, yeah, no, I love that. I was going to say, I used to use World Books. Did you have those? You remember those? That's what we did in my day.
Yeah, see, I had Funkin' Wagnall. See, again, I'm old. We literally got my encyclopedias from the A&P, which is a grocery store in North Carolina. It's sad. It's very, very sad. But
we do have a question that's come up. So what software do you recommend for telehealth?
There's various platforms. Right now, we're still actually waiting to see how this is going to play out because the HIPAA regulations have they're still lifted. So right now, not a lot of folks are picking telehealth platforms. There's some pretty big arguments like, do you want to keep it within your EMR? My preference would be to do that. I think that's the best mechanism. But if your EMR has not caught up enough, there are other platforms out there. Interesting question. Because today I also read about a fantastic, like, I think it looked really cool. Again, sales pitch or whatever, but Microsoft is playing in this space and they have an integrated tool now that they're actually rolling out through their teams that is HIPAA compliant. So the ease in which a lot of us already use Outlook and Microsoft 365, and with Microsoft rolling this out, you can see how it's going to nicely integrate. So my preference on telehealth products is also a little different based on specialties. Some are better than others with regards to their specialties because some of them actually have been built a little bit more fluidly for the specialties. So, you know, I hesitate to actually recommend a specific product. I would be glad offline just because that would be my preferred. If you have a question about it, I would be glad to actually have conversation with you one-on-one. I can share with you what I've seen in different specialties. But right now, you're sort of safe. That's the thing. I think your preparation for plan B is to get out there and start looking at it. Again, some EMRs have better products than others, and I've seen that. So it depends also on what EMR you're on.
Yeah, because I know a lot of doctors jumped right in to just use the one that their EMR came with, but they're not necessarily the best, perhaps. And now, as you're saying that this is going to continue, you know, I think it might be an interesting time for people to start to
sadly there was actually, like, I knew of a couple of products that were on the market that were HIPAA compliant. They were really great products. They actually got destroyed in the pandemic because of the release of the rules by the federal government that no HIPAA rules were required. So no one had to pay for it. You could use FaceTime. You could actually do all this stuff without any fear or reprisal of HIPAA. So it actually shut down some really great telehealth platforms that will probably re-engage once HIPAA re-engages. The hope will be, though, that there will be enough time to do that. That's going to be the challenge. And it is an unfortunate side effect that I saw happen during the pandemic. So what are the biggest changes practice will need to make in 2021 to stay ahead of the pandemic? So this is actually from one of my other presentations I do with a lot of independent practices. I like acronyms. I like to do stuff like this. Most of you will remember me because of my great hair. That's the ongoing joke between me and Risa. But if you can't, this is one of the key terms that I think about make. Motivated, anticipatory, kinetic, and earnest. And actually I use these words to describe what you need, I believe, to have within yourself to kind of maintain this going forward, this level of independence. You got to stay motivated. A lot of physicians lost motivation during 2020, both because of the financial impact and they weren't prepared. There was something like to the neighborhood of about 16% of physicians just closed their doors or joined a health system. It was a very large number. Around 8,000 physicians in 2020 actually just sort of exited the system as independents. You've got to be anticipatory. And what I mean by that is actually prepared going forward. You've got to be thinking about what is the world going to look like? This is why we're having this conversation. I don't have all the answers. Nobody does. If I did, I would have told you guys that COVID was going to be a big deal. I think most of us, you'll recall back in February and March timeframe, a lot of us thought, okay, yeah, we're going to be closed for about a month. You know, that's cool. We can do that. You know, I haven't been back to my church since March, and it actually is tough. You know, it's a very difficult thing for a lot of us to be dealing with. Anticipatory is actually a key word for me. Kinetic, you got to actually be constantly in a state of motion. You have to be adaptive. It was really great to see how many physicians adapted to telemedicine as quickly as they did. And a lot of them actually, we resisted until the pandemic came upon us. So I want everyone to maintain that level of kinetic energy going forward. And that's to do it with earnest. You can't just say, oh yeah, okay, well I have telemedicine now and I'm going to do it now until nobody wants me to do it anymore. You can't do that. I mean, my hope is if you want to grow as a business, you actually have to be a life form. You're constantly adapting. You're constantly adapting to your environment, and you have to do this with a level of earnestness that actually is imperative. Otherwise, you can just be blockbuster, which is fine. That's an approach in business. You could be blockbuster and say, I don't want to be in the streaming business, and I'm just going to let it ride down. That's my plan. That's okay, but I will tell you, then you're a Mac, not a make. So. Most important thing we need to keep in mind for 2021, don't be myopically focused on technology. It's a mistake. It is a mistake to just sit there and go, okay, if I can just get this part fixed, that'll be important. I want to remind everyone, I don't know if you guys recall this or not, but in January, we actually had a new president elected. I don't know if y'all remember that or not, but that did happen. That change of administration is actually paramount because there's a lot of things that are actually in motion. And again, some of my notes I have up here, just to give you some perspective about telemedicine, for example, the current secretary for HHS is, the current nominee, for example, is pledged support for permanent telemedicine expansion, permanent. Now that philosophy is different than the prior administration. The prior administration did believe strongly in telemedicine as particularly for the delivery of more cost-effective care, but it was from a different perspective. This perspective is to actually access more and get more to folks that are, quote, at risk. And again, it's the philosophical and political shifts in the environment, and it's important. And again, I don't really have a preference or a dog in the fight of what your political position is. It doesn't really matter. Understanding the power of the government, the very first slide I showed you in this change of administration, that's important. And I've got some other pretty cool, I will encourage you guys to, if you haven't done this before, there's really some cool snippet websites that I actually encourage you to follow. They're all based in it's called Fierce Healthcare. So go out and look at that. That's where I get a lot of my little nuggets, this little pops of information. There's a lot of interesting articles specifically around President Biden and some of the near-term changes and other changes. There's actually some similarity in the two administrations, that some things like price transparency, some of the prescription drug programs, those are actually staying in motion. That'll be great. There's some more long-term programs. Expansion of Medicare and Medicaid is an active interest that has a lot of value for some of our specialties here on this call. You also have some extension of ACA. That has also been an active move that we'll see continue for the next 4 years. Continuation, and we just talked about this. I'm sorry, I should have clicked So the other is competition, the shooting gallery competition. This is one of my slides. I put it like just about every one of my presentations because I quite honestly love this and was one of my favorite things to do at Arcade. So you'll notice there's all kinds of activity up here. These are real legitimate competition. I've noticed there's a new product, for example, that Cleveland Clinic is doing with someone else. It's actually, they're basically advertising second opinions, which I thought was fascinating. It's an interesting way of getting yourself out there, and they're soliciting these second opinions, nationwide. That is competition for you. When I was going through my procedure, actually was part of the UNC healthcare system. It's been sort of fascinating because the very first time I went to UNC, I broke my wrist. I went to the ER. I did not have a primary care doctor. Within a week, UNC called me and asked me if I would like a primary care doctor because they noticed on my medical record that I did not have one. That again is competition. That is using information effectively. Teledoc, it is losing money, but they are a prize of Wall Street because they are generating over $1 billion a year in revenue. They are growing at a very, very active clip. They're aggressive and they're going after your patients just as much as you can imagine. Retail clinics. The article I was telling you guys about that I read, which was sort of fascinating, was entitled "Consumers' Growing Comfort with Retail Health Could Prove Critical to Vaccine Effort." And this was actually done by J.D. Power and Associates. Well, if you think about like none of this has anything to do with healthcare. This all has to do with consumerism and patients' comfort levels in these new mechanisms for communication, for alternative solutions of when I need healthcare. And finally, capital preservation. And actually what I do here, if you'll notice, this is a little play on words, preparation. If we learn nothing more from last year is it is not a bad idea to have a rainy day fund. Our hope is everyone here on this call has a hope that we are seeing, hopefully, a downslide of COVID. We hope that. But just in case, be prepared. There are several of you probably who actually got the accelerated payments. There's still some that was already been delayed once. That's supposed to start coming back in April. It'll be interesting. That actually may be extended. I haven't seen any articles yet, but you can a bit of the tea leaves, if you will. The hospitals, the American Hospital Association just presented that they anticipate hospitals lose on average 120 or overall about $122 billion. That will probably tie into the COVID relief bill that's being presented right now, still in Congress, the $1.9 trillion bill. A lot of folks are scrambling to hold that money, get that money. Rural hospitals have been hit very, very hard. So again, this capital preservation is key as we go forward into 2021. We want to be thoughtful and thinking about this as we go forward. And with that, I am all done. And my hope is there might be a couple of questions here and there. If there's not.
Yes.
Okay.
Yeah, we have some. So thank you so much, Cam. I'll leave this up on the screen if you guys want to take a screenshot or copy his personal email, and then we'll get to a couple questions here. So I encourage you at this time to use the Q&A feature or the chat feature and enter in any questions you would like. Really, Cam is a wealth of knowledge. I really encourage you to take advantage and ask anything that may be on your mind. So hopefully you guys have all taken this screenshot now. You can always chat and I'll give it to you, but make this smaller so we can see Cam a little bit bigger. Hi there. And that nice hair we were talking about.
That's right. That's right. I did have COVID hair. We were going to put that picture up for all of y'all to see. I did have COVID hair. I grew my hair out just like I did when I was in high school. It was fantastic.
Okay, so let's see. Here we go. So do you think that, do you know if conversion rates go down if the consultation or visit are done virtually versus in person?
Yeah, there is. I don't think the conversion rate does not. Now, probably what you're really asking there from a Medicare perspective is that the value, the RBRVS portion of it, the conversion rate's not going to be affected, but the RBRVS is probably going to be devalued. So like in the terms of Medicare, just for all of us here to understand, the conversion factor times the RBRVS, the various RVU values, you have three breakdowns. You have a practice expense, medical let's see, a practice expense, malpractice expense, and then one other one I can't remember off the top of my head. But anyway, your practice expense would be lower in a telemedicine delivery than it would be in an office setting. And that makes sense if you think about it, because you are not really expending all that other expense like the nurse, et cetera. A lot of you will argue with me that, yes, I do still have that expense. You are correct. You do still have that expense, which is why I mentioned to you earlier about Starbucks. You need to actually start to understand and pivot that. One of the things that I've talked to several groups about is, and go back and think about this, is something that a lot of practices haven't really thought about. Am I going to need this much space 10 years from now? So if you're currently in discussions about your lease, or your lease is coming up in the next year or two, and your landlord wants you to sign a 7 or 10-year lease, the question you need to ask yourself is, can I actually shrink my space and deliver care remotely so that my overhead is actually brought down? A lot of folks make the mistake that they try to equalize telemedicine with an office visit. And really what I try to do is make folks try to understand, let's understand what our profit delivery is, our profit margin is on a telemedicine visit. Let's take that actually into account so that we can begin to understand how to effectively deliver this as best as possible going forward.
Got it. I guess I meant also for an elective procedure. So if they're having a consultation to decide to do it or not, if I've heard a lot of physicians say, if they're in the office with me, I feel like they're more likely to go forward with it, especially if it's something they can do in the moment, freeze something off, do
Right.
Botox, whatever it might be, versus if it's virtual.
Yeah, and so again, you guys, I mentioned to you in the beginning that I don't think just in terms of healthcare, what you're talking about there is the end of aisle purchase. So when you're in the grocery store and you don't realize that you actually wanted Doritos, and you walk by them and you go, dang, I didn't know I wanted Doritos, and you buy Doritos. That's what you're talking about. You're talking about an on-demand type purchase. And yeah, that's going to go away. But then what you need to do is actually, again, just facilitate. Okay, so how can I actually do better marketing? So for example, for those of you who actually had patients back up, you have information about your patients in an electronic medical record. Go and do some homework. Do a little bit of research. You know what your needs of your patients are. Those patients who actually had that, there's nothing wrong with just reminding them that you're still here, you're still available. People also, when you think about marketing, one of the things that a lot of folks have is fear and concern about coming into the office. So highlighting the efficiencies and the safety protocols that you've done in your office setting is something that will actually help allay that fear and bring those people back into your office.
That makes sense. All right. So we saw the revenue numbers that you shared for 2020. Do you think in 2021 revenues are going to be expected to get back to 2019 or higher, or are we going to see another down year?
I think from a revenue standpoint, one of the things that we recently did for a couple of our clients, it was sort of fascinating. This client happened to be in South Carolina, and one of the things that we noticed was that Medicare actually reimbursement for 99213s went up dramatically. And what was sort of fascinating about this is nothing's necessarily going to change, but getting those patients back into the office setting, their reimbursement went up, which will be great. Now, what's also fascinating is it really the real issue is going to be is workflow. That's really going to be the issue. If we have another surge, for example, and surgery centers get shut down, then anyone doing those type of procedures, orthopedics, ENT, ophthalmology, it's going to be negatively impacted. So the revenue, remember that your revenue formula is price times volume. So prices is not really our issue in 2020. It was really volume. The irony of 2020 is that actually a lot of providers that we have run into were able to kind of recreate and catch back up at the end of 2020. And a lot of providers we saw actually had better years in 2020 than they've had in the past. And that was because of some of the federal funding that came into play with the loans, et cetera. So that's where I was saying, again, that capital preparation is what I really want folks to think about. If you actually did well last year, put it in a hold. That's what I would like to see a lot of you do.
Got it. Okay, great. All right, two more questions here. I know you're going to love this one. What jobs inside the practice do you foresee may be replaced by technology and this shift that's happened to our industry?
I think probably the biggest at-risk position is the front desk. I really do. And that has, it's two things. One is just the logic of it. I always, when I do presentations, I talk about Southwest. And again, I'm 50 years old, and I can remember the very first time I went to the airport, and everything was done by someone at a desk and all this other stuff. And now there's like three people. There's 500 of us in the airport, and there's three people like sort of getting us through this whole entire environment. It's very expeditious, and it's the use of technology. We are one of the last industries not really to grab onto that. I think that's probably the most at-risk position. There are actually some other positions that are probably at risk with regards to intake. If you, again, begin thinking about it, the more and more information we start to share, the more and more intake is actually going to probably go down. So you're going to see, again, probably a shift in educational needs, maybe, where you're going to see more CNA type as opposed to, full-blown RNs. We've already seen that, over the years anyway, but I think those are some of the things I think that are probably the most at risk.
Yeah, I definitely agree. I've seen a lot of practices start to do a lot more of things that would normally be done upon check-in. They're doing it ahead of time, automated over text, over email, preparing for the visits. And then even the nurses that would come in and explain post-op care and things like that are now also being automated. So it's.
Yeah, and it has actually a lot of value. Like again, I took my daughter to see a neurologist. I never talked to a person at all until the nurse came and got her. And it was fascinating because there was no uncomfortable, how are you going to pay for this $40? It just popped up on the screen and said, swipe your credit card. It didn't, it wasn't, there are no niceties. There's no uncomfortableness with technology. That's the advantage that we have lagged behind a little bit, is break that barrier down. And that's really what we should be kind of taking the advantage right now. The pandemic is to use the moments of opportunity while they're hot.
Absolutely. Actually, I know you brought up my son who's 2, and he did not get as sick as much as he probably would have without COVID, but he did at one point get sick, and his pediatrician, it was all drive-through like you said, but then they prescribed something, and we actually went to a literal vending machine in the back of their office, put in our slip with like a QR code, and it popped out. I mean, they probably, they had like the most common antibiotics and medications.
That's fantastic. Yeah. And I think you're going to see more and more of that. Yeah. You're going to see more and more of that. I mean, and again, like we won't get too far down this pathway, but you have future, even medical specialties that are at risk really for artificial intelligence, et cetera. One of my clients, a radiologist, they are now actually embracing artificial intelligence to actually help them speed up their read times. So it's, it really is fascinating. And it's only going to evolve at a quicker rate.
Absolutely. All right. I think this is the last question for now. So do you recommend that medical practices explore offering COVID tests or COVID vaccines? I've heard mixed messages about the revenue. Sounds good, but having sick patients in my office does not. And if we do proceed, what would be the first step, and what do we need to know?
Yeah, I think my philosophy on that a little bit is, if it's in your space, I think you consider it. I think it's going to rapidly be a challenge space. Like you're actually already seeing now the introduction of some at-home COVID tests being mailed out. I mean, so it's feels a little bit late to the party. This is really, the simple way of answering this question is a pro forma. Like I would do it from a business standpoint. I would look at what is the volume that I need to actually deliver to make profit? What's my break-even point? And then to make profit, what can I do alternatively to make the same profit? That's actually how I would approach the subject matter. I wouldn't do it, just because a lot of times where physicians make their mistakes is they just look at revenue. They don't look at what is the profit. I want to know what the profit is. Since it's our last question, I will use my grandfather, who owned a gas station in Raleigh, North Carolina for a long time. It was a Texaco. They forced him to do this new thing called zip marts, where they didn't have, to work on cars anymore. You just went and got gas and you bought a drink. And my grandfather, I still remember him vividly telling me the best thing that ever happened to him from a profit standpoint was a soda machine. He said, these people actually come in here, give me $1 for something that only cost me a nickel to make. He said, I love it. He said, I don't even have to move. They actually go and make it themselves and then bring it to me and then give me $1. So It's understanding your profit margin. That's really what you want to understand with this decision. And again, it's going to be independent to your practice. I'd be happy to help you kind of walk through it if there's a specific scenario.
So Coronis Health is a medical billing company, but those are types of services that you can help people
Yeah,
with?
absolutely. Yeah, I mean, we've actually done this. One of our recent clients, one of the things that we encouraged them to do was to facilitate some of this like patient forward communication technology. We encourage that. We actually also did some of our own analysis with regards to these reimbursements where we talked about, we wanted to see what the impact was going to be in 2020. Again, trying to project 2021, project what the year was going to be like for them. That's much more the partnership mentality that we have as opposed to just, filing claims.
Got it. Well, thank you so much. I really appreciate it. Thank you to everyone that tuned in. We did get a couple questions for, can we have copies of the slides and can we see the recording? And the answer is yes, this was recorded. We will send it out. We're happy to share the slides for you to share with your practice. Someone says, we hope to see you at the SCMGMA conference in August in Hilton Head, South Carolina, where Cam will be speaking. We have a number of conferences that he'll be speaking at that you can see on our website. But anyways, I hope you all found this useful and it made you think. And if you have any further questions as you ponder some of these big things that Cam brought to our attention, Cam would be more than happy to help you. He did share his email, but you can always contact Coronis if you didn't get it on our contact page on our website, and we'd be happy to help. And anyways, any last words, Cam?
Nope, that's it. I hope all of you have a wonderful evening. Thank you for participating and joining us tonight.
Thank you so much, Cam, again, and I hope everyone has a great evening. Bye.
Bye-bye.